Good morning. I'm Michelle Sibisma, Director of Education here at Sadaho, and I'd like to thank you for joining today's webinar, Calm Down and Other Things Not to Say, Communication Strategies for Risky, Stressful Times. I'm really excited to have Polly Sullivan here today from Ready Inc. For those of you that don't know, Ready Inc. is a crisis management company that delivers crisis preparedness, communication and response training, and reputation management strategic planning services for businesses of all sizes and kinds. Polly has worked with a myriad of industries, including healthcare, military, manufacturing, and agriculture. Ready Inc. also works to develop smart plans for managing issues and crisis with confidence. So we're just very fortunate here at Sadaho to have Polly share her expertise in these crisis-related challenges and how we can apply it to the current situation today. So we do have time designated at the end of the presentation to answer any questions from the group. I would encourage you to use the chat feature within Zoom and ask questions throughout the presentation, and then they will be answered at the end. All right, I'd also like to mention that Sadaho Enterprise and CHG Healthcare will be sponsoring the call today. And because of their support, we are able to offer this call for no charge. Sadaho Enterprise was developed to pursue valued services and increase non-dues revenue. Overall goals and objectives of Sadaho Enterprise is to provide revenue to supplement Sadaho strategies and provide support and benefit to members through services such as CHG Healthcare. CHG Healthcare is the other sponsor, and they are a privately held company that does staffing in all 50 states and is the nation's second largest healthcare staffing firm with a comprehensive service offering to include temporary physicians, PAs, and nurse practitioner locum tenens services. So through trusted companies such as Comp Health, Weatherby Healthcare, Global Medical Staffing, RN Network, and Foundation Medical Staffing. If you have any questions related to CHG, please let us know and we can connect you with a representative from that company. Right, I now have the pleasure of introducing Polly. Polly Sullivan is our speaker for today. And as principal and lead counselor to Ready Inc.'s clients, Ms. Sullivan develops enterprise-wide crisis preparedness solutions and trainings that inspire confidence as well as the culture and communications infrastructure needed to anticipate, prepare for, and manage issues and incidents. Polly has over 25 years of experience in journalism, public relations, and crisis planning. Thank you, Polly, for joining us today.
Well, thank you, Michelle, and good morning, everyone. Michelle, bear with me for 1 minute. I'm having some trouble getting my slides to advance.
Oh, okay. Let's see. If you click the arrow, does that help? Let's see, is there an arrow on the left?
Let me just try one thing. Let me stop sharing and check on something on the computer, and then I'll reshare. And I apologize to everyone for the delay.
No problem. And just a reminder to the group, if you can just make sure your line is muted, that would be awesome. And at the end when we do open it up to Q&A, if you do have a question and you're on your smartphone or you're on your cell phone, you just push *6 and that will unmute your line. So just wanted to put that reminder out there. Awesome.
I think that's working now.
All right.
Thanks for your patience, everyone, and thank you, Michelle.
Good.
Don't panic. Calm down. You know, you look kind of stressed. How did hearing those phrases make you feel? Pause for a second and think about that. Did your heart rate increase a little bit? Did you feel a flash of anger that someone was telling you what to do without explaining why? Maybe you felt judged or criticized in some way. Phrases like these are well-intended, We've all said them. We've had them said to us. Because when we're faced with someone else's stress or concerns, it's hard not to want to make it go away for them and for us. But on the whole, phrases like these and others don't decrease tension and concern. They increase it, and they minimize our natural emotional response to high-stress, risky situations. So how can we communicate effectively with people who are tired and stressed and scared and emotional, especially when we also have a lot of those same feelings? And how can we thoughtfully develop and deliver messages on behalf of our facilities or companies in a way that ensures critical life-saving information gets through to the people who need to hear it? So today, I'm going to share some research and perspective and tips and tools that you can use to communicate effectively with colleagues and patients, family members, and others as you and your organization strive to prevent and respond to COVID-19. So first, we're going to review some principles of crisis communication, what works and what doesn't. Next, I'll walk you through a process that you can use to plan for communicating with your organization's stakeholders. And finally, I'll share some practical templates you can use in specific situations. We'll wrap up with a Q&A session, and I'll be glad to address any specific communication scenarios or concerns that you might have. There are volumes and volumes of research on risk and crisis communication, and if you ever want to delve further into this, I've provided some sources and links at the bottom of the slide. What I've found through working with an observing organization in crisis is there's really four main concepts that you need to keep in mind, and we're going to spend some time talking about each one. The first is that stress changes how we process information. Our brains function differently in a crisis, and our communications need to align with those differences. The second thing to keep in mind is that empathy is what opens the door for you to share your expertise. In a crisis, people gravitate to those who exhibit empathy. The third thing you'll need to keep in mind is that perception of risk is highly personal. People are going to make decisions of what to do and not to do to protect themselves based on their perception, and you need to understand how to navigate that. And then the final thing to keep in mind is that repetition and consistency assure attention and retention. To be heard in a sea of information, like we're in right now, you'll have to say the same thing several times using consistent language. Stress changes how we process information. Let's walk through a hypothetical situation together. So for this exercise, let's pretend that you and I live in the same neighborhood and that I am that neighbor. I'm nosy. I'm always weighing in on what people are doing wrong with their lawns, with their houses, with their lives. I have an opinion about everything, and I don't hesitate to tell you. Now, on this particular day, you're home, as many of us are home right now, and I, the nosy neighbor, call you, and here's what I say. Your phone rings, you pick it up, and you hear me say, "Hey, it's me, your neighbor. Did you know you've got smoke and flames coming out of the upper window of your house? Whew, looks like quite a conflagration. Maybe bad wiring in the attic? Well, I'm on my way to the store. Just thought you'd like to know. Good luck with that. Talk to you later." And I hang up on you. As someone communicating with you about a life-threatening situation, what did I do wrong? How did I make you feel? Maybe you were confused or scared or angry. Why? Because I was flippant and casual and wordy in the way I was communicating. I used less familiar words like conflagration. I went immediately to speculating about the cause of what was going on, the wiring in your attic. I appeared unconcerned and self-focused, and I clearly had my own needs that I was taking care of and my own agenda. I was going to the store and just wanted to let you know what was going on. Now, obviously, I devised this somewhat ridiculous scenario so I could make a point. In reality, in the event of a fire, who would really do this? But you'd be surprised at how many organizations and individuals make these same mistakes and end up sounding inconsiderate and bossy and tone deaf when communicating with people who are at risk or under stress. So now let's flip the script. What should I have said? As a concerned neighbor, what could I or should I have done to help you in that situation. It's as simple as this. My phone call would have gone this way. Your house is on fire. I've called 911. Get out. Now that's a great model for risk and crisis communication, and here's why. So under normal circumstances, most of us can manage to comprehend and retain up to 7 messages. You and I could have a conversation, cover 6 to 7 topics, and we could remember most of what was said. In risky, stressful situations, your ability to comprehend and retain messages drops from 7 to 3. Again, if you and I are having a conversation on an average day, I could order the information I'm sharing with you in the way that seems most appropriate with me, and you'd still follow along. But in a crisis, if you have pressing, urgent questions, I need to answer those questions first. Otherwise, you won't take in or register anything I'm saying until you hear the answer to your question. You're tuning out any information that isn't relevant to your most pressing concern. So 3 messages in the order that answer the listener's questions first. And the last bit to remember about high-stress communications and the why our brains work differently in a crisis is that when we're under stress, our comprehension actually drops about 4 grade levels. We need simple, direct instructions. So the bottom line, to align communications with how our brains operate under stress and when we're faced with risk or a threat, keep it simple, focused, and clear. 3 messages, answer their questions first, keep the language simple, and grade level appropriate. Our second principle, that empathy opens the door for sharing expertise. We know that in crisis situations, people gravitate to leaders and companies that demonstrate empathy. If you have scientific expert information to share and want to deliver it to your audience, you have to first demonstrate that you understand their circumstances and their feelings about it. This doesn't take as long, nor is it as complicated or as touchy-feely as it might seem. Writer Brené Brown has an excellent video where she explains empathy, and I've included a link here. First and foremost, empathy is about taking the perspective of others, walking a mile in their shoes, putting yourself in their place. We demonstrate empathy by recognizing and acknowledging other people's emotions, their point of view, their greatest concerns, and also being empathetic means staying out of judgment. We don't judge people and we accept their perspective as their truth. So let's look at the communication of empathy in a professional setting. This is an example from the 2009 H1N1 outbreak, and it has personal significance for me. Around that time, my daughter was about 12 years old. And one day as part of my job, I had sat in on a government webinar about the impending H1N1 outbreak that honestly freaked me out as a parent. I wasn't sure what to do to protect my daughter. As a working mom, I didn't know whether to keep her home or send her to school. The situation was complicated and I was really anxious. The next day, I was listening to a CDC media briefing, and Dr. Frieden, who was the CDC director at that time, responded to a question about how to protect school-aged children. And as I listened to his answer, I remember exactly where I was in my house and what I was doing when I heard this question and this answer. I remembered feeling understood and reassured, and that I had the right information to make decisions about my child's safety, and I knew where to go if I needed more information. That moment was so profound for me and so memorable that recently I searched online and I found the transcript of that briefing. And it's funny because I remembered his answer as being very elegant and empathetic and detailed, when in reality it was really quite simple and straightforward. The first thing he said was this: kids need to learn, parents need to work, there's a lot of important things that happen. There's a lot that happens at schools that is very important. That's what caught my attention because that was my concern and my dilemma. And then here were the messages that followed. If your kid is sick, please keep them home. They'll get better quicker and they'll not infect people around them. Elsewhere in this briefing, there were also additional resources where I could go to find out what the symptoms were that I needed to look for. The second point he made: schools should ensure that kids who are sick are separated and sent home with a parent or caregiver, and that kids cover their cough, cover their sneeze, and wash their hands. And finally, if those simple steps are taken, the number of people who become infected will come way down. Simple, focused key messages wrapped with a statement of empathy. Another quick example, same press conference, the question about vaccination availability. Statement of empathy and connection with the audience. We are now in a period where the vaccine availability is increasing steadily but far too slowly. Acknowledgement of the problem. It's frustrating for all of us. Acknowledgement of the feeling or emotion. We wish there were more vaccine available. Statement of a desired future state. Then what followed, we need to remember that the enemy here is a virus. He reframed the problem. Pandemic influenza is very challenging to deal with, indicating that there's going to be more challenges ahead. And finally, that all of us can be part of an effective response. We can do something. So you see here the combination of an empathy statement, the 3 simple messages, and an order of concern to the listener. One important thing to remember, to be empathetic, you have to listen. You must ask questions and get feedback to make sure you understand the audience's perspective. And in times like these, when things are moving fast and time is at a premium, it seems counterintuitive to slow down and ask questions. But it's critical to understanding and make sure you can deliver critical information. Take the time, set up channels for feedback, and find opportunities to listen. Our third principle, risk is highly personal. Perception of risk is highly personal. We know that stress changes how we process information, and then an expression or demonstration of empathy enables you to share expertise. You also need to keep in mind this aspect of risk. A multitude of factors affect our perception of risk. It could be experience, genetics, proximity to the threat, whether we have a loved one at risk, the amount of trust we have in the information source. Basically, we can't tell other people that they should or shouldn't be concerned about a risk. They have to decide for themselves what's safe and what's not, and how much risk they're willing to take. Walk into any grocery store today and you'll see this in action. Some people are wearing masks, others not. Some people are wearing gloves. Some people aren't even there at the grocery store because they determined they're safer if they stay home. Perception of risk is personal. So how do you make sure people are listening and do the right thing, or at least make better choices in response to risk? It's important to emphasize the we and reiterate the why. The concept of flattening the curve is a great example. From my personal experience, when this visual started showing up in my Facebook feed, I noticed that many of my friends who had expressed doubts about the COVID-19 threat and had voiced concern for recommended actions really started to change their tune. People are more likely to seriously consider risk mitigation action when they understand the reason for it and they feel like they're not alone in standing against the threat. What else can we do to shift perceptions about risk and encourage right action? Well, we can provide science-based, credible information, cite the sources. You can recommend specific, meaningful action. You can take every advantage and every opportunity to build trust. Show up and be present. If something's happening at your facility related to COVID or any kind of threat, be willing to go out and speak up early on in that. Don't make people wait for information. Model best practices. If you're having a meeting with your staff, wear a mask, practice social distancing, whatever it is that you're recommending that other people do to keep safe, you need to model that as well, and everybody in your organization needs to model that. And be transparent. This is one of those situations where we don't always have all the answers, and there's a lot of things we don't know. What you can do is share with people what you're doing to find out the unknowns or how you're going to navigate in the face of those unknowns. And make sure they understand the process your organization is following in response to COVID-19 or, again, whatever crisis or threatening situation you're involved in. Repetition and consistency assure attention and retention. And let me say that again. Repetition and consistency ensure attention and retention. By this time, most of us can recite by heart the personal steps for preventing COVID-19. Wash your hands, avoid touching your face, cover your cough or sneeze. That's because once those guidelines were established, we've heard the same messages over and over again from multiple sources. Here's how the response team at Swedish Healthcare of Seattle described their use of this principle. We want everyone at Swedish Health to hear important information 7 times in 7 different ways. We don't always get there, but the more information flow we have, the more likely we are to get important messages out to everyone. That may seem overwhelming, but in a crisis, communication is about repetition. And I want to note, when they say 7 different ways here, they're talking about different channels: postage and signage, briefing, email, peer-to-peer messages. The wording of the messages I expect was consistently similar when pushed out through all those different channels. For every topical that's critical for you and your organization to communicate, make sure you're nailing down your 3 main messages and support points, and repeat them everywhere and often. So we know that stress changes how we process information, that risk is personal, and that empathy and repetition and consistency matter. Now let's build on that and focus more broadly on the topic of communication planning. There's still time for you to get organized and develop a thoughtful approach to communicating with stakeholders, even as the concerns about COVID increase in your region. And just a quick definition here: when I say stakeholders, that's anyone who has a concern, an interest, a role within your organization, anyone that has a stake in what you do and in the outcomes you want to achieve. So here's a great example of why we plan and why we want to tailor our communications to specific stakeholder groups. This scene is typical of what you see in many hospitals and medical facilities these days. Perhaps your building entryways look like this. And all well-intentioned, all individually great, well-designed posters and messages. But if you were a visitor, would you know where to look first or what to do? What if you were a staff member or a vendor or a family member? It's cluttered, complicated, and overwhelming, and it's not customized to the individual group. All of that runs counter to the principles for risk and crisis communication that we talked about earlier. So to communicate effectively, we also need to tailor and target our messages. At Ready Inc., we have a process we call Compass that we use to develop and manage stakeholder communications in a crisis, and it goes something like this. C is for classify and characterize your stakeholders. O is for outlining stakeholders' needs and identifying the leaders best suited to engage with each group. M, modify messages and channels to align with stakeholders' needs. P, put processes into action and practice those processes if you have time. A is to accommodate fluid situation and changing stakeholder needs. S, survey, gather feedback. This is the listening action that we talked about earlier. And S, shift to new realities, prepare people for what comes next. The COM portion of this acronym is the planning phase. PASS is when you put your plan into action and continue to develop and tune your messages and methods. The critical starting point is classifying and characterizing your stakeholders and outlining their needs. And you can do this formally or informally, but it is important to think it through, especially as we go into a period where you may be faced with dealing with COVID-19 cases. The tool we use to do this is a stakeholder map, and here's how it works. On the left-hand column, you list out the groups of people who are critical to your organization. I listed here staff, patients, vendors, others. You could have board members, any other groups that you deal with on a regular basis and who might have specific communication needs. You can also break these down further. If you're at a large facility, you may want to have a set of messages specifically to your emergency room staff versus your staff who aren't directly involved in response. Try to keep it fairly high level with just enough detail to make the messaging exercise valuable. The second thing you do is we think about, for each of those groups, what do we need them to know? What are the things that we want them to do or we need to have them to do to make our response successful? And then you flip it around and take their perspective. What will they want to know? What's important to them? Then think about, overall, between what we need them to know and what they need to know, what are our overall messages? In every conversation and every communication, what is it at a high level we want them to take away? And finally, how and when will we communicate those messages? And then how will we gather feedback and information? Our team put together just a little description of how this might look if you were mapping out that for your staff. And so here's what we came up with. If it's staff, what do they need to know? They need to know what to do if they're sick. They need to understand the personal protective equipment guidelines and the types of issues and incidents to report up through your chain of command. What they're going to want to know probably is, what are the leave and benefits policy if they get sick? What are the potential risks to them and their families? And then how do they protect their families? Overarching messages for your organization might be, our mission as always is to provide compassionate, accessible, high quality health care. To do that during this pandemic, we must coordinate, communicate, and care more than ever, and your health and safety are a priority. We could communicate those through daily briefings, emails, door signs, etc. And then we have suggestion boxes or internet for information and feedback. The stakeholder map becomes the basis for developing messages for that specific audience. So here we took the key messages for staff included in our stakeholder map, and now we're creating a staff message map that includes supporting points and facts related to each message. So for the second message, that we must coordinate, communicate, and care more than we have ever have before, here are our proof points and the backup points to that. We will hold staff briefings via webinar every day at 10 a.m. We'll post all current information and policies on our SharePoint site and text you when we have new information posted. And we've identified a team care coordinator, and here's that person's name. Contact them with any questions. So those are the basics on how to put together a communication plan. And now to wrap up here, I want to give you some templates that you can use to support specific communications in specific settings among your team and with your stakeholders. The guiding principles that we talked about earlier are baked into these templates, and you can use these in planning or even just to handle a phone call with someone or structure an email. The first one that I'd like you to have in hand is a holding statement. Holding statements are developed for that initial communication when a situation is developing and we don't have all the answers or the facts aren't known. Now, what I know as a crisis communications professional and a training professional is that it's super hard for companies to get out information within the first 24 hours, and a lot of companies do not want to be out speaking publicly when they don't have all the facts. But the nature of crisis is that you need to be out and speaking as soon as the public or key stakeholder groups are aware that something is going on. Because if you're not showing up and talking about it, they either think you're ignoring it or you don't care. So a holding statement gives you a way to get out and acknowledge the situation up front, and it also puts a placeholder in the future for you to share additional information as it becomes available. It demonstrates an awareness of the situation and engagement in the response. It opens a channel for ongoing communication. You can use this internally for briefings, for media interviews, for external briefings to stakeholders. Super simple structure. It goes like this. 1, here's what we know right now. 2, here's what we're doing to find out more about or address this issue. And 3, here's when or where we'll follow up with more details. So as an example, I drafted a statement that an organization might use in response to the first case of COVID-19 in a facility. And let's say that I'm an administrator of a facility and I'm speaking to a group of family members over a phone-based briefing. So here's, I would say something like this. Today, we have identified a potential case of COVID-19 in this facility. We expect to have test results within 24 hours. That's number 1, what we know right now. We have isolated the patient and taken all necessary precautions as indicated by the CDC. We have notified the patient's family. So 2, that's what we're doing to find out more and address the issue. And then 3, we know you are concerned about the well-being of your family members. Their care is our primary focus and concern. We will continue to provide daily updates on our website at 10 a.m. every day. And if you have any questions or concerns about your family members or specific operations of this facility, please contact and then provide an email address and name of that person. So 3 things to take away from that is it makes it clear to your stakeholder groups that you're aware of the situation, that you're addressing it. You cite clear action as to what you're doing, and then you give them a way to follow up with questions so you don't have pent-up demand for information between now and the next update on your website. So stakeholder briefing. This is when you're delivering critical information about important actions to reduce risk. You're trying to keep a group of people updated on the status of an emerging situation, whether it's all aspects of your COVID-19 response or one specific situation within that response. It's a way of, again, of demonstrating awareness of the situation and engagement. It opens a channel for ongoing communication, and you could use this for internal or external briefings. It goes something like this. You open with an empathy statement. The first thing you do is provide a succinct summary of the current situation and the most relevant details. This ensures something that we call a shared operating picture. Everybody has the same information and can apply that to the information you provide that follows. The second piece, again, is to address the stakeholder group's most pressing questions first. Remember, we talked about that earlier, that in order for me to listen to what you're saying, I need to know that my questions are going to be answered. Then you're able to share your organization's most important messages, and then you can also describe any actions that you want stakeholders to take and when and where they can expect more information. It's always good to close with when you're going to be talking to them again or where they can look to next for an update. So again, I created an example, and these are not examples that you can necessarily use verbatim. I would consider them drafts, but I wanted to give you, to show you what this would actually look like in practice. So let's say again that I'm the administrator of a facility. We announced yesterday publicly that we had a potential case that we were testing for, and today I am briefing my staff via a socially distanced meeting where everyone is wearing masks. So I would say something like this. Good morning. Yesterday was an extraordinarily tough day for all of us as we managed our first case of COVID-19. I know you're tired and worried, but we will continue to navigate this as a team. I've never been more proud to work with you and to be part of this team at our facility. Here's what you need to know up front. This morning, test results confirmed that the patient is positive for COVID-19 as the clinical symptoms indicated. And as we noted yesterday, we've isolated the patient and are taking all necessary precautions. Thank you to all of you who helped us keep that patient safe and comfortable when we moved them into the isolation wing. After talking with many of you, I know you have many questions, but two in particular are top of mind. How do we prevent the spread of COVID within our facility, and how do we protect ourselves and our families? I'm going to spend some time today talking to you about both of those things. All right, I'll pause there. I opened with an empathy statement, what we're all feeling, how we're in this together. I led with a summary of what was going on specifically relevant to the situation, and then I made it clear that I was going to address their specific concerns. What follows that will be a reiteration of the messages that we talked about and the specifics that follow. How are we going to keep you safe? How are we going to keep your family safe? Why that's important to us. And then again, describe any specific actions during the day that we want people to take and when and where they can expect more information. Closed loop communication. This is a way of ensuring that your team's communication is coordinated and that information and assignments don't get lost and misunderstood. I'll tell you a little bit of a funny story. My team and I sometimes refer to this as the "do you have the baby" method. And that's right, I said the "do you have the baby" method. Here's the reason for that. When my daughter was a baby, I took her in for a well child appointment, and the nurse and her assistant were working together to weigh and measure my daughter. And I noticed that as they passed my daughter between them, there was always a moment when they locked arms under her, looked each other in the eye, and one would ask the other, "Do you have the baby?" And the assistant or the nurse would reply, "Yes, I have the baby." And they wouldn't complete the handoff till it had been acknowledged. So that's the gist of closed loop communication. It's taking a moment to repeat back, confirm the communication, confirm your understanding before you walk away. Now, the reason this is important in a crisis is because we're all moving really fast. We all have a lot of critical information that we need to share quickly, and a lot of times things get dropped. And we can't have that happen because a lot of times it causes more problems both for our organizations and for our patients. So, for example, if you send someone an email, someone sends you an email asking you to participate in a meeting at a certain date and a time, you reply back and say, "Got it, I'll be there Tuesday at 10 a.m. And maybe you ask a follow-up question. Do you want me to give a report about the status of our PPE? You could also, when you give somebody an assignment, ask them to repeat it back to you and then confirm or add any additional details. Make sure the understanding is complete before you walk away. And one additional template that you can use, in a crisis, there's no time for long conversations or meandering reports. If you're part of a crisis team, I really strongly suggest that you use this SBAR format, which I'll explain what that means, because it gives you an easy way to organize either a verbal or a written report. You can use SBAR to give an update in a meeting, to provide an email update. The reason it's important because it keeps meetings succinct and on track. And if you organize your information in this way, people are more likely to listen and to take in what you're requesting or what you're explaining. So SBAR goes like this. Situation status, that's the S. Background, what do people need to understand or know in order to understand the situation? Assessment, how bad is it? Recommendation, what are we going to do about it? And then finally, request and resources. What do we need in order to follow through on the recommendation? So, simple example, I'm in charge of managing my organization's supply of personal protective gear. Situation status, as of tomorrow, we are going to run out of N95 masks. Background, we are using N95 masks at a rate of X per day. Assessment, there's a shortage of masks and we cannot continue to do our work in this facility without them. Recommendation, I've located a vendor 2 states away who can provide these by tomorrow morning at 10 a.m. Requests for resources. In order to do that, I need a purchase order and I need authorizing me to spend X amount of dollars to get these, and I'll need somebody at the loading dock at 11 o'clock tomorrow morning to meet the truck and unload it. I promise you that if you deliver reports in this method to your response team leader, they will really, really appreciate you. And you're also more likely to have people hear and understand the recommendations that you're making. So in wrap up, make communications your priority. Good communications matter in a crisis. What you say has to match what you do, and what you do has to match what you say. And to make people hear you, you have to, again, understand why the communication formula is different, how people are going to interpret risk, and you need to repeat things over and over again. So here's a summary of how to think through your communications. 1, make sure you set expectations for when and how often staff and others will hear from you. That's going to save you a lot of problems in the long run and a lot of panicked questions from people if they know they can count on you to show up at a specific time and place to let them know anything new that's going on or what the status is. 2, remember to focus on we. People want to understand that they're part of a bigger effort and that they're being supported. So also demonstrate empathy and concern for the well-being of your staff and any other people who are involved in your response. 3, deliver clear messages about the current situation. Remember, 3 messages: order priority to the listener, simplified language to address that drop in grade level comprehension. 4, speak to principles and procedures, reiterate why. Information's changing quickly. You need to share with people what you're doing as new information emerges, as the situation changes, and you need to remind them about why you're doing the things you're doing and the reason you're doing them the way you're doing them. And continue to acknowledge the situation is fluid. Things are changing. The organization will continue to adapt. This prepares people that tomorrow you may be giving a different recommendations or saying something different than you did the day before. People need to understand that things are going to change. So thank you all for your time today. I just want to leave you with one final thought. These are tough days, and it's likely there's probably some more tough days ahead, both as a region for you in South Dakota and for our country as a whole. I just want to remember, if you forget everything else, just remember to be kind to yourself, because you need to take care of yourself in order to be an effective communicator and frontline responder in this. Be kind to your families, your patients, the people around you. Because especially in times like these, the best communicators are those that accept their humanity and acknowledge their vulnerability and practice kindness wherever possible. And that's really what it's all about. So thank you very much for your time. Please feel free to stay in touch with me. I've provided our website and my email address on this final slide. And with that, Michelle, I'll turn it over to you so we can answer any questions that may have come up.
Wonderful. Thank you so much, Polly. And just a reminder, if you do have questions, you can use the chat feature in the Zoom or *6 if you're on your cell phone to unmute your line. So I do have a few questions here, Polly. One of them is every day we're learning new things about COVID-19 and we don't always have all the answers. So what do you recommend if someone does ask tough questions and really they probably shouldn't or can't answer the question? How would you recommend they respond?
Sure. Well, first of all, that's one of the biggest fears and biggest challenges for anybody that's communicating is what if I get asked a question that I don't have an answer to? First of it goes to preparation. If you are a spokesperson for an organization, you should have as much information as possible. But like we said, COVID-19, a lot of the information is changing daily. We're learning more about the disease, the way it spreads, the virus, all of those things. So if somebody is persisting in asking you a question, the simplest thing to do is to state wishes. An example of this was the question about vaccines that we reviewed earlier. You can say to somebody, you know, I wish I had an answer for that right now. We know that scientists are working on finding out the answer to that, and we're staying in close touch with our colleagues at whatever facility. So again, that's where you can state wishes, and then you can invite people into the process so they understand that that information is important to you too, and then you're working to find it out. Now, if you really can't answer a question, either because of patient confidentiality or for some other reason because it's against the policy of your organization, it's okay to say to people, you know, we can't share that information, but you have to tell them why. We can't share that information because it's in violation of HIPAA, or we can't share that information because it's our policy to not share the names of people who are in our facility. Whatever the reason is, and it should be a valid reason, if you can't share the information, explain why to the best of your ability.
Fantastic, thank you. Our second question is around media and communication. How should we handle questions from the media? What do we tell our staff if they're approached by a reporter? The starting point is, as part of your planning process as an organization or a facility, you really need to think about what you want your relationship to the media, with the media to be. I think everybody's initial reaction is we don't want to interact with the media. But in smaller communities, especially, the media can be a really important outlet for you to get information out to the community and to family members. So go into this with sort of a plan for how you want to interact with the media and what types of interviews or questions that you will take. One way to stay sort of a little bit in control of the story, again, is if you just do a daily or weekly media briefing, or if you have a reporter that you can share that information with. Again, the media can be useful to you in this situation. Regarding specific employees, I think it's best for any facility or organization that the media inquiries flow through to one central liaison, and that person can identify the most appropriate spokesperson. So you need a little control. The thing to do is to tell your employees that if they're approached by a reporter, first of all, the employees shouldn't say no comment, because that's going to get printed, or they shouldn't say, I'm not allowed to talk to you. And believe me, I've seen people in organizations take their company's media policy and apply it that way. The better thing is to teach your employees to basically say, thank you for your interest. I need you, because I have work to focus on here, I need you to refer you to our spokesperson, and he or she will put you in touch with the person that can best answer your questions. And if the reporter persists, the employee can just say, look, I understand that, but it's our policy. Here's that person's name and number, or even give your employees a card that they can just hand the person with the spokesperson's name on it. You're fortunate that you're in a situation where your employees really are focused on life-saving work. So that's easy for them to say to the reporter, you know, I have things I need to focus on here. Please take your questions to this person. That takes a little bit of training, but it's worthwhile up front addressing for your employees not only how they should handle those interactions with the media, but also how they should or shouldn't talk about your organization on social media. So they need to think about that as well. Great. Thank you, Polly. It looks like we're at the end of time here, but as a reminder, I will send out the recording after this presentation along with the slides again, and I'll make sure that Polly's information is included if you have any questions after this call. So thank you again, Polly, for spending time with us today. And we'd also, again, like to thank our sponsors, Sadaho Enterprise and CHG Healthcare. Take care, everyone, and hopefully you stay safe. So have a good day.
Thanks, everyone.